Hello everyone, welcome to our live and many congratulations to all the Indians. They won the match and you see what happened. So Indian team also wanted that we all should continue with our series. We should not take a halt. And that was actually the doubt. I thought if the match would be very interesting and it would go to the last over, I always thought then it would be uh, very confusing for the students for what to do exactly. Should we watch the match? Should we go for our live series? So that's why I put up yesterday that do you want us to continue this marathon series or you want one break? So we have tried not to take any break till now, and as you can see that even today I'm not in Mumbai. Today I'm in a city called Bhuj in Gujarat. Good evening, Dr. Shyam Kumar Vaishnav. So I'm doing my live. We're trying to be as consistent as we can, and last time's lecture was amazing by Naveen Boss, and I had requested all of you to do watch. I hope you have not watched. It starts from 15th minute because there was a problem, there was a technical error, and for first 15 minutes we could not start with him, but once he started there was no end to it. The kind of knowledge that poured in last Saturday's session was amazing. Hi Shwet, how are you? And we wanted all of you to know that this kind of teachers, they're actually not very much available on Instagram. So we are thankful to Dr. Ranjan Belsare who is requesting them. And today's speaker is Dr. Kanika Sabharwal. She will be continuing. Hello, Dr. Poonam Bhatia ji. Dr. Kanika Sabharwal is a very good friend of mine. We have worked together in Dr. Farooq Master's class clinic. We have practiced together in our science charitable clinic, where both of us used to see good amount of patients, and we share a good rapport, and she is a phenomenal teacher. I think all of you who are from CMP know that very well, that Kanika ma'am is such a nice teacher, and she is assistant professor in Department of Obstetrics and Gynecology, and I should thank her that she agreed to join us, because last week and yeah, Shwet says absolutely. So Kanika ma'am is here and she should be with us any minute. Kanika ma'am, I've sent you an invitation. You might see it on your screen, and once you join, you'll be with us. We are starting with picric acid and we'll end it up on pyrogen today. So there are some interesting remedies. So I wanted Kanika ma'am to join us, and we are thankful that she's come today. I did a poll and 85% of you said that you wanted to be. अभी मैं देखता हूँ आज वो 85% 126 लोगों ने पोल में बोला कि उनको ये सेशन चाहिए था. अभी देखते हैं ना ये लोग किधर से आते हैं. जी. Hello, Ashi Jain. Ashi Jain is from Motiwala College. Yeah.
Hi.
Hi.
Hi, Abhishek.
हाय कैसे हैं आप? How are you?
ऑल फाइन। आप कैसे हो?
All good. We are very excited. We are very happy to see you with us.
Yes, I it's my honor and privilege both, I would say,
No,
to be on this platform, which
not
has
at all.
been doing very good work for the last few weeks.
Yes, my voice is low. Is my voice clear? Can you hear me?
To me, yes.
Yeah, okay. Might be then that there's some viewers have the problem. Okay, so we always wanted you to be with us on this uh, platform. We are trying to uh, be as open, as transparent as we can be. And thank you so much for joining. And we are really excited. I was just talking about you that we have worked together in Dr. Farooq Master Sir's clinic and in Science
Absolutely.
Clinic, and it was great pleasure working with you and about your and yes, I think those students who are not from CMP, just I'm not I'm sorry, I know you would feel embarrassed, but I'll tell you that Kanika ma'am had top was a first ranker at the MD entrance examination also. So she's not just a good teacher, but she's been a wonderful student as well. And yeah, I think she still is always there in all the lectures of Dr. Farooq Master Sir. She continues to learn and she continues to teach. So this kind of an attitude, I think that is what ma'am has, which because of which she has wonderful practice and she's a wonderful prescriber.
I think, Abhishek, I've listened to your previous sessions, and one of your principles was no introduction, only get to
No,
work.
I'm
So
not.
I think
No.
let us
We'll get
stick
to
to
know.
that.
I no. I just because I just wanted those who are not from CMP. I thought just they should know that today's guest is so important to us.
No, no, that's very kind of you.
Okay.
I hope that I'm able to live up to the previous sessions and such a wonderful introduction. So,
Okay. Let's start picric acid then. We'll start with
sure.
picric acid.
So, I think when you talk about picric acid, I will talk about two sphere of actions where I feel that this remedy is super important. And the first one, which probably everyone is most familiar with, that is the brain and the spine. And especially when you talk about the spine, it's the lumbar region. So picric acid not only covers pain, but it also covers tingling numbness. And I guess if there are some students here, everybody knows that, in repertory on materia language, the word tingling is not there. So you'll see formication. So there are so many cases that we have, for disc prolapse and even including sciatica, where if there is more of the lumbar spine involvement, one can think of picric acid. And of course, the other sphere of action is the headache. But before I go to that, along with this, there's another symptom of picric acid which talks about priapism. So again, priapism, if somebody doesn't know the meaning, it's it used to describe painful and persistent erections, and with that comes the strong ammoniacal odor of urine. And the reason that I've kind of clubbed this together is because just 10 days ago, I have used this remedy on these indications where I've treated a dog who was suffering from IVDD, which is the equivalent of disc disease. And that dog was finding it very difficult to walk. The pet parent, she also said that the urine had a very strong odor and he would just wake up in the middle of the night with an erection which was not getting reversed. So with, picric acid given over a week's time, he improved quite a lot. So that was one clinical confirmation. And similarly, in an elderly lady of 80 years old, in fact, one of my students' grandmothers, I did use this remedy for her lumbar pain. And, he said within 5 days, he came to me and he said, ma'am, I'm so grateful she's now walking. So I think that's the kind of scope of this remedy, Abhishek. So if you'd like to add something about the lumbar system.
No, I think what you said is absolutely true, and I would just like to add that we've used this remedy more of like because it's an acid. We all know that there'll be a lot of the weakness, there'll be a lot of tiredness, there'll be lot of heaviness around, which is in the first line itself of Boger Synoptic tea, and it's more of the kind of symptoms and a kind of complex that it's formed. It's more of kind of a student's headache where there's a lot of aggravation of reading and there's a lot of
Absolutely.
aggravation when the person starts concentrating when there is a pressure on eyes. So all these symptoms where the students have peculiar headaches while they're reading before examination. So this remedy covers up all the symptom complex very well.
Absolutely, absolutely. And you couldn't have said it better, because today, through COVID and the way even the education system has been structured, there's so much that students are even reading off the screen. So that's dual, right? It covers the mental exertion of the remedy and screen time, the reflection of the light kind of adds to the headache from mental exertion. And since you spoke about headache, I'll just add one very important modality of picric acid headache is better by tight bandaging. We often get especially middle-aged women with migraine, tension headaches. They say, doctor, I need to literally tie a scarf and make it as tight as possible to kind of get relief, and that's covered as well, quite well, by this remedy.
Yeah, true. I totally agree. So that is, I guess, about picric acid. Can we switch to the next remedy? That is Plantago.
Yes, Plantago. I think just one more thing, sorry, before we move ahead. In picric acid is also one sphere of action, which is also mentioned in boric, is ears. If a patient gets recurrent or a boil in the ear, just by location, you can think of picric acid. Sometimes we have, like we say, the characteristic can be the location, the concomitant. So in this case, the location becomes quite important, where picric acid is a pretty specific remedy for boils in the ears. So I think these are the 3-4 indications which I've used this remedy.
Great. Yeah, okay. So let's go to the next remedy, Plantago major.
Yeah, I think Plantago, the moment you say Plantago, anybody that is associated with homeopathy has one key word to say, and that's toothache. I think extensively most of us must have used it in practice for that. So maybe we can just do a quick recap first of the dental pathology. So we should understand, that yes, a lot of times it's just used as mother tincture for toothache. Somebody's had some dental work done and there's a lot of pain, you start with it. But I would also advise everybody that, even the symptoms, take the acute totality, and it does also cover, putridity, and even for decayed teeth like dental caries. Also think a little bit of Plantago when you talk about Merxol and creosote in the same wavelength, because it also covers stylism. Stylism is excessive salivation. It also covers the putrid taste. Yeah. So I think a lot of times, we go just ki toothache hai, single symptom, Plantago. We don't think of Plantago. At least, I've not seen a lot of people prescribing it for dental caries and where there's a little bit of pathology involved. So maybe we can expand our horizon to that as well.
Yes.
And along with that, there's also toothache with pain going to the ears. So again, typically people look at Merxol for, throat or oral pain extending to the ears. So I would also recommend that don't miss out on Plantago for that.
True. I just want, maybe it's not, I have not read it in many of the literatures, but kind of this stylism, and also where Boger is mentioned about polyuria. So I don't know if there can be any diabetic background in the remedy, where it could be because of maybe in diabetics also we see that there is a lot of caries, there is a lot of recurrent caries that is coming up. So maybe there can be some kind of a background. Maybe we've not explored it very well, but maybe in future, or maybe if the provings again take place, somebody who's very senior on this might lighten up or something.
True.
About this.
Sorry, go ahead.
No, I was just saying that have you ever read anything about this, or have you ever come across anything like this?
So no, actually, no, I haven't. But now that you're saying it, maybe we can explore that. And as somebody rightly wrote in the comments also, I'm sorry I missed your name, but a very valid point that it's also nocturnal enuresis. So polyuria, along with, loss of control. So we can explore that. And maybe if we have someone here who's already made this clinical correlation, you could definitely leave us a comment, and, some of us could sort of try that in practice.
Yes. Okay. So I think that is about Plantago. I don't have any much experience, like what you said. A lot of people have used it in local application and dental caries, but I think this is just one thing which we could conjointly highlight that maybe there is a diabetic background in this remedy.
True. Interesting.
Yeah,
So
yeah, and
we Saturday night experiment, guys, homework by Dr. Abhishek. So Monday, when everyone's back in OPD, please either read or try to make this correlation and get back to us. No? And that's what I wrote
yeah,
today on my Instagram. I said we are all students, so
yeah,
always happy to learn something from someone. And also in Plantago, another thing which I would encourage people to explore is de-addiction. Okay,
yeah.
tobacco. I'm talking about tobacco at this point. It is not mentioned in Boger, but if you read Boric and other references of Materia Medica, just wanted to add that you can explore it. It produces an aversion to tobacco. And not
Hmm.
only that, it also treats the depression and insomnia, which are sometimes symptoms that we see due to withdrawal. So I don't know if anyone listening in has any experience in that regard. Also, definitely let us know. But these are two areas that are kind of explored with
Yes,
Plantago.
perfect. Okay. With that, let's go to the next remedy, which is a very good remedy, and we also happen to touch few points of it while we were discussing palladium in the last point. But we'd like to get few highlights from you about this next remedy is platina.
Yeah, so I think Platina, when you talk to someone who's doing a lot of focus area in gynecology, Platina is like something when it comes to Platina, Palladium, Pulsatilla, it's like quite,
So we are very fortunate that we have a homeopathic gynecologist, somebody who is working so extensively in gynec ops. So we'll get to know about these remedies very well today.
we try to keep it quick because I
Yes, yes,
don't think anyone
yes,
wants
yes.
really a kind of lecture at this point on
No,
Platina. But I think what you mentioned is a good starting point where Platina and Palladium are similar. They also, by way of structure, where they come in close proximity to one another in the periodic table. So the similarities kind of start there from the noble metal group. But I think that when everyone talks about platina and palladium, there are a few points which everybody feels are very common in terms of the egotism or the superiority complex. But I think
hmm,
it's important for us to differentiate. So I'll just try to summarize the difference in this egotism and haughtiness by giving you one example how I have understood. So I would say that in platina, they prefer to, earn the respect, where it's like I am the boss, I'm in charge, and therefore people should give me that respect and position. Whereas a palladium patient or a patient that requires the remedy palladium will demand the respect and kind of force it out. Like to give you an example, I always give examples which are relevant situations. So, like, let's say, since I'm a teacher at a college, if I'm someone who that requires the remedy platina, I will inherently have this kind of image that, okay, I'm the teacher. When I walk into a classroom, when I walk into my OPD, since I'm the one in charge, my students keep quiet, they stand up, they greet me, all of that, and I greet them and the class moves on. However, if I'm palladium, and if even one student doesn't fall in line with this decorum or doesn't sit up or doesn't take note that I've come, I will make it a point out that student, make them stand, reprimand them, saying, have you not seen ma'am has come to class? What should you do when ma'am comes? So I think there's a fine line where Platina earns it by code of conduct, by knowing her position, whereas in Palladium, it's a bit more like you have to do this because I'm the boss. Can you elaborate, Abhishek, from your expertise as well?
no, just about what you said is absolutely correct, and what last time Dr. Naveen Singh sir was here who
Yeah.
is a teacher from Calcutta Homeopathic Medical College. Even he said just I think just a haughtiness is a very differentiating point in both these remedies that it would be differentiated on haughtiness. Rest, I think whatever you've spoken, and we all know about this remedy very well about the erotism, egotism, all these things, and the kind of sphere of action which it has on the female genital organs and pelvic organs. So just one thing, one thing which is very clinically verified and has been taught by Dr. Farooq Master sir also, and I've learned when I'd gone to Dr. L.M. Khan sir also, that platina has constipation with soft stools. So this
Correct.
is one of the confirmatory symptoms which I've seen these stalwarts or these experts asking at the end of the prescription that do you have constipation? Do you have ineffectual, like, do you feel that you have evacuated enough? they say we feel that there's something remaining, but most of the times the stools are never hard. It's a soft stool
Correct.
constipation. So which is
Correct.
one of the confirmatory symptoms. And I think in spite of getting all the symptoms that we might read in multiple books, but in this might be one of the confirmatory symptoms from your clinical practice.
Correct, correct. And in fact, since you mentioned that, and not leaving behind Boger, which is our topic of the day, Boger very interestingly mentions constipation of tourists as well as constipation versus pregnancy. So, we talk a lot about travelers' diarrhea is what we hear often, but
Yeah.
tourist constipation, which is in clinical practice also, I think a lot of us, patients do come with this that doctor, I went somewhere, and typically in an Indian Bombay OPD setup, they say कि हवा पानी change होता है ना doctor, तो मुझे बहुत तकलीफ होती है, पेट खराब होता है. So either way, whether it goes the diarrhea way or the constipation route, one can definitely think of this remedy. And as you rightly said, I think mind most people are quite familiar with. So since I'm just talking about differentiation, I'll just add one point at the physical level. Think of platina when you have left-sided ovarian affection. Sorry, I have to bring Dynac into the picture. And think of palladium for right-sided ovary. So, if you have on USG like a large hemorrhagic cyst, an endometriotic cyst where single unilateral ovary is affected, then even side affection can help you to confirm your mind picture if you're a little confused.
Perfect. And the remedy is very well differentiated. And the follow-up remedy, or which is the complementary remedy, is the next remedy, which is plumbum metallicum.
Plumbum, yeah.
So let's get to plumbum metallicum.
Yes. Would you like to take the lead on plumbum? Would you like to start?
No. I have just plumbum metallicum about the kind of chronicity it's depth. Usually the symptoms where or the cases where the plumbum metallicum is prescribed, the symptoms have come up very insidiously, very slowly. The chronicity is very important in plumbum metallicum.
Right.
So any kind of symptoms or any kind of pathology where plumbum metallicum would come up as a prescription, we have to have a lot of chronicity of symptoms. It cannot be acute. It cannot be fast. It cannot be sudden. This all cannot be plumbum metallicum. So very well, it has been mentioned that the remedy, the area that covers is spine and the spinal cord and the nerves, and relate when the spinal cord and the nerves are involved initial part, and then it starts covering the muscular dystrophy, the muscle part. When the muscle pathology comes later, and the neurological deficit has started first, I think in such cases, plumbum metallicum is one very important remedy that we should know. And obviously, we have other symptoms like plumbum metallicum for convulsions, for epilepsy, rigidity, the rigidity of muscles, where there is a lot of cerebral ataxia, kind of cases of cerebral ataxia. And obviously there is, again, because the spinal involvement is there, we have a very classical symptom of constipation where there is round ball stools, where a lot of other remedies are being covered. But just here I'd like to quote a case of Dr. Farooq Master sir itself, that there was a case, I think those who have attended his seminars might be, they must have seen this case. There was a case in Saifi Hospital where he had taken me. I was with him while he was treating this patient, and the patient had traumatic paraplegia. Below the neck, the patient had met with an accident and he had multiple spinal fractures, which were being definitely treated. So initially, the initial remedies were arnica, rustox, ergotin. And when the last part of the treatment left, when he started walking, when he started doing everything, there was just right foot drop. There was just right foot drop with constipation. So for plumbum metallicum, I think 3C and 6C went on for weeks and weeks. And finally, at the end of 6 months, even the right foot drop covered up. So that's how I remembered plumbum metallicum very well in my practice. And I knew that plumbum metallicum is usually, we tend to remember things much better when we have seen it happening in front of us.
Absolutely.
So that is
That,
about plumbum metallicum. Please share your uh,
yeah, I think, the main thing is like exactly what you started, and I think that should be in capitals. It's also mentioned and highlighted in Boger, sorry, is slow onset. And the other thing, exactly like Dr. Abhishek said, is that first neurology and then muscles, because nerve supplies the muscles. So I'd just like to do a little bit of differential materia medica here, where, like this also, again, it came from a case which I was discussing with one of my teachers, Dr. Jayesh, the other day, where if you look at plumbum metallicum, the paralysis is of single parts. All right. Now, when the reason I'm highlighting that is we have to, it comes similar to another remedy called Lathyrus sativus, which I think a lot of us know. Today only we had a follow-up case in our OPD where the patient has been affected by poliomyelitis and comes from some other complaints. He has started walking better with Lathyrus, even though now he's in his early 30s and obviously got afflicted with polio a long time ago. So single parts or single muscle involvement, think more of plumbum and Lathyrus sativus. If it's more generalized, if you refer, again, differential materia medica, if you look at groups or multiple muscles affected simultaneously, think of gelsemium and curare. So I think that is somewhere where, we can differentiate in our clinical practice. And since you spoke, about the spine symptoms, and I think we also started today's discussion with picric acid, which is another kind of, this is a very similar sphere of action. So I think here we can add one more remedy if it's not an overdose for everybody of materia medica, called thallium. So thallium metallicum, most of us know thallium. Since I'm a teacher, I think I can ask some questions. What does everyone know thallium met for? Any common indication that you all have used it for? Let's be a little interactive. Tell us. But
yes. I'm sure we'll get a lot of answers.
I'm sure because
Our audience
it's a
is
very intelligent audience.
intelligent audience and very interactive audience. You just give them chance and they'll start typing. Yeah, poor Shwet. Yeah, see, I'm
Yeah.
coming
So
from CMP. The first person is to answer is from CMP.
thank God.
No, there are a lot of people. See, everybody's hair fall, hair
Perfect.
fall,
So see,
baldness, hair
all
fall.
of us will talk about thallium met for hair fall. But if you look at thallium metallicum, it's a little applied medicine, maybe a little much for a Saturday night, but I want to give you something new. So thallium metallicum mentions, saddle anesthesia. Okay, now I'm not going to go into too much medicine, so I'll just give you the terminology and everybody can read it at their own time. Saddle pattern of anesthesia is characteristic of a condition called as cauda equina syndrome. And there was one case, but it wasn't mine, so I'm not going to share it. But I just want to bring to everyone's notice that these remedies can be used even for such gross pathologies. Okay, please, I request you, don't spoil your Sunday, maybe Monday onwards. Just read a little bit about cauda equina syndrome, clinical features, then read thallium met and tell me whether it matches or not. I'll be very happy. And moving ahead from spine and colic and constipation that Dr. Abhishek has already mentioned, I'll again add one thing because I have to stick to my gynac roots. Don't forget plumbum metallicum for tendency to abortion from infantile uterus. There's a hypoplastic or an infantile uterus that has not developmentally grown to the complete size. We have 3 cases which I know of in my hospital. Both belong to teachers of mine. And good success where that lady has given birth to a healthy baby, and now that child is fully grown and developmentally fine. So that's one clinical indication I'd like to share.
Great. So we have 2 important points from this plumbum metallicum, and I think cauda equina syndrome. Even I will read, and we all will post, and we will all tag you.
No, they'll say Sunday also we get homework. This is not fun.
No. We people are very fond. I'll tell you, every time Sunday we get messages. We have seen this, we read this. So we have a wonderful audience and we have wonderful
Amazing.
engagement with them.
Yeah,
So
somebody's already posted. I never get such a quick response. Amazing.
fornication, beginning of fingers and extending through the pelvic perineum and inner thallium med. See, I tell
Lovely.
you, these people are very quick.
Yeah, I'm so grateful to the audience, and on a very lighter note, I'm also very grateful to my Indian cricket team that made everybody free. I say Rohit Sharma और विराट कोहली को छोड़ के मुझे सुनने कोई नहीं आने वाला है.
No. That's I said no. I said at the beginning before you joined. No, I said 124 people have said that they want this session to happen today. I want attendance of all those 124 people who said yes on a match day. So, but luckily, all thanks to Rohit Sharma, we finished up quite early, and everybody's there in the session.
No, but really, I mean, on a serious note, very commendable. I'm glad to see such a group of dedicated homeopaths, students, practitioners. It's amazing. Yeah. So I think that pretty much covers plumbum from my practice.
Plumbum we've covered. Next is Podophyllum peltatum.
Yeah, I think again, Podophyllum. If you ask everybody right now, they'll throw out all the symptoms. So let us start with the obvious, which is the diarrhea, and keep it very simple. After Cauda equina, if you have to learn Podophyllum, just make one big alphabet P if anyone's taking notes, and just write down the 6 P's. That's how I remember it right from student days, because its diarrhea is what Kent became known as a high potency homeopath for, and that's pretty much verified in clinical practice as well. So the 6 P's to describe the Podophyllum diarrhea, I would say first is profuse, second is putrid as regards the odor, third is painless, fourth is very descriptive but polychromatic, which means multicolored, fifth is prostrating, which means that it causes a lot of debility, and last is associated with rectal prolapse. So if you just remember these 6 P's, I think you can never miss a prescription for Podophyllum diarrhea.
Yeah.
Right?
Perfect. Yeah.
Of course.
Yeah. Just one thing I wanted to add.
Please.
For Podophyllum, this is something which I have recently read, and have some senior physicians have confirmed this, that Podophyllum, we all know the diarrhea part is covered. We are using it very well in our clinical practice, and it's working well. Podophyllum peltatum is also a very important anti-cancer property drug. So a lot of patients who are, students who are working in cancer OPDs, a lot of students who have basic interest in oncology. So you should read. I'll put down in the chat later on. There is a very good article from PubMed itself, that how Podophyllum peltatum has properties to reverse the multiplication of the cells, and how it can be useful. And I have personally used in a few of my cases of CA rectum in decimal scale, and this worked wonderful. So podophyllotoxin is an active principle, and it's wonderfully working. So
Super.
This is just one thing which I think if there's too many juniors, they might not know it. And if you read this article, it's of PubMed. It's not published by any hanky-panky institute. So if you read it, you'll get the authenticity of it. And when you read, and you'll see, and then you think over it. Then you start thinking that you start correlating how things might be working. So likewise, you'll also use in your practice, or you might suggest your teachers to use it if you're from college, and you see how things are working. So that is just about Podophyllum, which I wanted to add.
Amazing. I actually haven't used it, so I'm going to try it. And you said posology decimal scale works better.
Yeah, I have used in decimal scale, and it has worked wonderfully. And somebody's after effects of chemotherapy can also be used. Yes, can be used. Podophyllum can be used for after effects of chemotherapy.
Oh, amazing.
Okay.
Sorry. And I think, before we go ahead from Podophyllum, since we spoke a little bit about rectal prolapse, we should also remember that the same pathogenesis is applied to genitourinary prolapse as well. Yeah. So you can think of it for uterine vaginal prolapse, especially after delivery. So if there's been a prolonged labor and, a lot of strain on the ligaments and the supports of the uterus, you could also think of Podophyllum. And again, like we said earlier, like palladium, it also has a very marked sphere of action on the right ovary. So, we always think of lycopodium and apis when it's right-sided, when it's right ovary, but I want everyone to kind of just expand and look into these remedies. And someone has rightly said loquacity during fever. Yeah, super point. So I think that's a great point to add as well.
Okay. Yeah, great. Then I think that sums up about podophyllum. Next is Polygonum sagittatum.
So I'll be quite frank. This is the remedy I think from today's list that probably I've both used and seen the least prescriptions from. So might be a little theoretical the points, but
Yeah.
I think Polygonum again one has to think of in cases of basically genitourinary tract again is the main sphere of action, and Boger Synoptic uses two clinical confirmatory symptoms. One is nephritic colic and cystitis. Cystitis, of course, you think of UIOC, you go for your UTI remedies. But when this combination is there, maybe, we can again think of it clinically when there's a stone and with the back pressure changes, or if there's, sorry, not back pressure changes, if there's an infection, super added infection where there's cystitis and nephritic colic, and the type of pain described as cutting pain.
Yeah.
So again, looking beyond the regular remedies of cannabis sativa, and we can just maybe expand our knowledge and clinical practice to incorporate Polygonum. And another indication of it would be skin symptoms. It also covers urticaria. Again, I've not used it. We have a very good armamentarium of remedies for urticaria, so I haven't got the chance to apply Polygonum yet. But and eruptions which excoriate on the scrotum. So these are two symptoms which are there for skin. Maybe in our next discussion, we'll have more cases of, I'll have more experience to share on this remedy.
Great. Honestly, say whatever you spoke, we'll stick to that because I also personally have no experience of using Polygonum sagittatum in my practice, and I've seen my teachers using a lot of other Polygonums, so there's not much light that I can throw on this Polygonum.
Same, to be honest.
So, yeah. So maybe we can go to the next remedy, Prunus spinosa.
Yeah, so I think again, if I have to summarize Prunus spinosa in just one kind of take-home sentence, it would be Prunus spinosa is known as right-sided spigelia. So what's spigelia is for left-sided headache. Think of Prunus for right-sided headache. That's the way I would frame it first sentence, because it covers a lot of neuralgia, ciliary neuralgia, sphere of action, right side of the forehead, orbital pain. So a very similar picture that one would see in spigelia as regards the headache, and headache better by lacrimation. That's again quite a characteristic symptom, not seen it too much in practice. But clinically, where I have seen Prunus and I've used it is for headache. And second thing, if I have to talk about Prunus is, which is again referring back to Boger, is pains which lead to shortness of breath and air hunger. So if you hear of air hunger and if you hear of pains which are leading to difficulty in breathing, which is the first remedy which usually comes to our mind? Anyone?
Chat box.
They're going to be like, this is too much.
No.
Too many questions for a Saturday night. Okay, we'll wait for a couple of seconds, otherwise we'll give you the answer. No exams here.
They'll come. The answer will come up. Belladonna. Somebody saying
Belladonna. Okay.
Shalini Vadvani is saying Belladonna.
Shya Kalmia. Okay.
Shraddha Singh, Carbo Vesh, Poonam Bhatia.
Very good answer.
Saying amyl nitrosum.
Amyl nitrosum, again, very good. So yeah, I think usually, if it's GI pain and like gastric discomfort causing shortness of breath and air hunger, carbo veg is definitely usually what comes to mind in practice. Some people use China. So don't forget Prunus in the respiratory complaint, and in Boger's complementary remedies also it mentions lauroseraceous, which we all know for cardiac pathology, and both Dr. Abhishek and me, as we mentioned at the start, our mentor Dr. Farooq treats a lot of such cases, and we are very grateful to have learned lauroseraceous from him in quite a few critical cases, right, Abhishek?
Yes. Obviously, I was not allowed to say. I would have said lauroseraceous at the beginning because we have seen, because we being from the same background, from the same school of thoughts. So we know that in such cases, the first remedy to pick up would be lorosirosis.
Absolutely, absolutely. So that's why I said we should know, because a lot of times, especially when we are fresh out of college, we're very, certain remedies will only talk about one sphere of action. Like, if somebody says aloe, you'll only talk about rectal
Yeah,
complaints, or like similarly to podophylum, GIT. But I just wanted to, a little bit expand, which is what the
yeah, yeah,
purpose is of
yeah. True.
these sessions. So I think as regards prunus, from my experience, it's just these two things to share, predominantly headache, which is clinically verified.
Yes. So just about prunus, that prunus spinosa again, I've not what ma'am said is correct about prunus spinosa. What I've used about prunus is prunus virginania. If there's a different prunus called as prunus virginania, and it's called as a remedy for alcoholic heart disorders. So when you read prunus virginania, and again prunus spinosa also, again because we've had better experiences with lorosirosis, so we never went down to use prunus spinosa. So it's quite theoretic again to just stick to whatever symptoms ma'am has said, and that would be about prunus spinosa.
Absolutely.
Yeah.
Yeah.
So next is a big remedy. So usually what we do now, for big remedies, we just highlight to 5 points because of very detailed, obviously, like we said that it's not a classroom where we
Yeah.
keep studying, but the remedies like Surinam, remedies like Pulsarilla, we always want that if from your experience, what are the 5 things which would exactly you'll pick it up for Surinam?
Okay, so first I'll start with the
not exact, not specific 5, just any 5,
yes.
6, just yeah.
No, that's what I completely agree with your thought process, because otherwise these remedies are never ending,
Yeah.
So I think first I'll start with one core theme of Sorinum, where because of again the chronicity and the recurrence that this remedy brings in its sphere of action, the theme of the patient becomes, they kind of accept and they reconcile to their fate of struggle. So the whole journey goes from I have to struggle, and that struggle with illness brings insecurity, and they feel that, and because they're not wrong, their journey has been chronic, they feel that, मुझे हर बार कोशिश करके fight करना है. At both levels, of course, बीमारी या relapsing eczema के साथ तो fight करना ही है, but in a more metaphorically level, at a more metaphorically level, sorry, these people have that insecurity and they feel that I have a long road of struggle. And as somebody rightly said, that struggle ends with despair. So if I have to summarize in one line, I would say the journey of Sorinum goes from struggle to insecurity to try to keep up a fight, followed by despair at the level of mind. Physically, I think I would just say 3 things: sphere of action, skin; thermal chilly; and mind despair. This is the 3-legged stool for Sorinum. I think, Dr. Abhishek, you would agree with me?
Yeah, totally I'll agree with you. If we
Yeah,
had
so
to
I
just
think,
sum it up to start with, like what you said, just a 3-legged stool. Otherwise, Surinam is a wonderful remedy, a very deep acting remedy. You can pick it up from anywhere. You'll see different school of thoughts in homeopathy. They're looking the way they look at Surinam in such bigger remedies, such deep acting remedies. No, you'll have a very and when I speak of different school of thoughts, and my friend Dr. Atul Mahajan from Predictive Homeopathy is here. So अतुल भाई, अगर आपको पता चलेगा, अगर आप कैसे आप सुराइनम देखते हो तो कुछ लिख देना, तो हम लोग को भी कुछ आपसे सीखने मिलेगा.
बिल्कुल.
Yeah. So that is, I think, about Surinam. Just one thing recently, last week, what Farooq Master Sir told us about KEM OPD. I think Shwe, I think there were some juniors or no, that traumatic injury to ovaries. You remember Surinam? That's what
Right.
Sir taught. So it's given. So there are a lot of clinical indications you should you'll get to read. But that's the moral of the story doesn't change every time when you go. it would sum up to these points what ma'am said.
Correct. Yeah. And I think if you talk about, clinical indication, just two things which I'll add. One might be a little theoretical, but one is verified in practice. One is increased appetite. So if you refer Boger or Boric, it is
Yeah.
mentioned unusually hungry before an attack of
Before
dyspepsia. You know, and there's another remedy which is very commonly used for GIT by every homeopath plus lay person. If you ask my whole family, they know Nux vomica. But the difference is, and it's a very minor difference, Nux vomica mentions unusually hungry a day before dyspepsia, and Sorinum, it's usually night. So, of course, like I said, clinical practice में इतना minute difference मुझे तो नहीं मिला अभी तक, but this increased hunger is there. That's one. Second, I would say, yes, before me, Shwet has said it, but don't forget Sorinum in a very high potency for lice. If you suppose somebody's practicing, has a lot of young girls, or is doing a camp at a school and you're screening, you'll get a lot of lice cases. So especially chronic lice, where they say ki shampoo bhi dala, clean bhi kiya, doctor, nothing is helping, please do something. So I would say Sorinum 10M has helped me quite a bit. So that's one thing which I'd like to add.
Yeah. And last thing about just Sorinum, I'll say when I went to Calcutta, I saw that Sorinum in acute cases of acute attacks of asthma, when the patient comes to the clinic and he has an asthma attack in clinic, Sorinum 500 is given for olfaction.
Interesting.
Yeah. So why olfaction? That we'll do it in chat. We'll do it in the comment section. Why Sorinum 500? Don't ask where do you get Sorinum 500. It's a very common question. Where do you get 500?
Yeah.
You get 500. You search, you'll get. If I get it, you can also get it.
Yeah.
Okay? So that is about Sorinum. Next is the one remedy which we want you to actually elaborate, coming from a department, from your department. This remedy, I'm sure, is being used very successfully in every possible aspect, is pulsatilla.
Absolutely. And not only is it used extensively, after 2 years of teaching gynecology therapeutics, where you cover definitely more than 100 drugs, any question you ask in Viva, can you tell me 2 remedies for this? Ma'am, sepia, pulsatilla. Ma'am, sepia, pulsatilla. So, you kind of get an overdose in this thing. But to be fair to the students, they're not wrong, because pulsatilla has such a vast scope of in gynecology. And I think I'd start from there because, mind and other things are quite known by now.
Yeah.
So I'd like to start by, obviously, everybody knows that pulsatilla patients are the ones who their constitution gets affected, and the first breakdown often comes in these girls at puberty. Right? There's Alan's keynote's opening line, never well since puberty. Now, in what clinical indications is it used? I'll directly go there so that we're not here for theory. Number one, premenstrual. The premenstrual syndrome, or the premenstrual scope of symptoms, is so vast. It ranges from the mind, where there's complete, weeping, low mood, right? When I have a class where there are only female students, I often crack this joke. I say, a lot of times girls say that, suddenly I'm crying and I'm in a bad mood and I feel the world is going to end. And then within a few hours, I get menses and I say, oh, that's fine. All is well again. So, we can take it as a joke, but that kind of tells us the indication of this remedy. And I've used pulsatilla for both PMS as well as PMDD. Now, PMDD, which is premenstrual dysmorphic disorder, is a mental disorder classified in the DSM manual. So I'd like people to know that we don't use this word very loosely. Okay, it can also be used for such like the more severe version of PMS. That's one. Secondly, Dr. Atul has very correctly said, think of this as the first choice of remedy in amenorrhea. Now we get a lot of patients of PCOD and DUB with oligomenorrhea, no cycle for 2 months, 3 months. And if my students are listening in, they'll say, ma'am is saying pulsatilla, but in OPD she gives a lot of medorinum. So I'll just differentiate that here. If she's a young girl, more pubertal adolescent age group, I think of pulsatilla in a higher potency, and it's worked really well to induce menses. If she's more in the reproductive age group, if she's married, if the sonography is showing a pathology, I think more of medorinum, obviously bringing in the antipsychotic element. And if I talk about menstrual affections, also don't forget pulsatilla for galactoria, which is when there's a milky discharge from the breast, in a non-pregnant female. So I think these are a few clinically verified symptoms. Of course, everybody knows really the basics, amenorrhea from getting feet wet, and irregular menses of pulsatilla, weeping during menses, diarrhea during menses. So those things I think everybody knows. When you talk about pulsatilla, the first word which people usually say is changeability. If you read Kent, Kent says that this changeability is not only at the level of mind, it also goes to the physical, where no two stools and no two menses are alike. And it's a very awkward question, or patients and students and doctors find it uncomfortable to ask, but I have clinically verified this. Where, if the patient says that one cycle is dark red, one is bright red, etc., like no fixed pattern, think of apply that grand generalization of changeability and use it here as well. So I think that's enough for gynec. I'll move a little bit to obstetrics. When you talk about obstetrics, yes, somebody's already mentioned that for labor pains, before she goes into labor, towards the third trimester, if the fetus is showing a breech position, pulsatilla is known to correct that. So these are clinical indications which are not there in Boger. So I'm kind of, digressing, but these are repeatedly verified at our hospital. Earlier we used to even conduct labors, and this has been clinically verified. So malposition, and secondly, yes, as everybody said, during labor, think of it for smooth labor pain. In fact, there's a condition called pseudocyesis, which is false pregnancy state, which is again seen more in dogs. Pulsatilla, a very good remedy. In fact, we've seen in some patients also where the state of pseudocyesis is such where she actually gets a little bit of breast discharge also. So pulse is quite helpful in that regard. I think as far as gynec obs is concerned, I've tried to give you something which is more than what everybody already knows.
Perfect. I just whatever you mentioned, like changeability, greenish yellow discharges, premenstrual symptoms, desire. What we again today we both are Dr. Farooq Master students, so we'll talk about that. Desire for whipped cream, desire for pastries. That is one thing which we are something which comes to my mind. Just I'm highlighting what is also mentioned here, that the nervousness, the puberty patients, the premenstrual complaints when they come with delayed menses, scanty menses, and you mentioned, like you also already mentioned, that any kind of gynec complaints and that pulsatilla organ. But here there's a lot of this personality of the pulsatilla, which is very delicate, which is very docile, is very nervous. So even one thing which you will always, I think you must have seen, we have seen in our practice, a lot of our companions have done that, is the nervousness, and the nervousness, they keep on biting their lips. So biting of lips is also mentioned in Boger, and the cracked lower lip is also a confirmatory symptoms, which I think if you just have a little bit keen observation on the patient, I'm sure you will see it, because a lot of times because we know we just I think in 5-10 minutes of case taking, we usually kind of a practice that we come up to the conclusion that okay, this is going closed, and then we get symptoms, and we don't actually observe these symptoms. But when Boger is mentioning, I think in all previous sessions we have covered this up, that if Boger mentions one word, it's equal to one page. So if Boger has mentioned this in highlight, it's there in the practice. And if somebody who is as junior as me, I consider my practice as not a very big number of years, but if we can see, I'm sure our seniors have done it, and also the juniors will see it. So just be very keen on observing this, and you'll definitely find this as one of the confirmatory symptoms.
Amazing. And that's always important, right? When you are thinking or you've narrowed down a
Yeah,
remedy based on the mind and the constitution,
yeah,
any strong physical confirmatory adds so much value.
yeah.
So I think that's a great point that you've added. And, you know, Dr. Abhishek is very humble where he says, I consider myself a junior. And I think because you're the one who's hosting this, no one gets a chance to introduce you. So next session, I'm going to come and have the honor of telling them about you and your accolades. That
No,
you
no,
know
no,
that,
no.
that is also important. You're doing such good work, and you know obviously everybody knows you by now. But
We are all, yeah, we are all
everybody
enjoying
will.
this with that.
No,
We all
I'm
started
going to take a
off with
poll.
this, yeah.
Next poll is how many of you want me to introduce Dr. Abhishek next time and tell you all about his
No, no, no,
accolades or some secrets both.
no, no. Okay. So we'll just last remedy for today, and we have pyrogen. Pyrogen, again, a very, very vast remedy.
Yeah.
There are few secrets of the remedy that are hidden, but I'll like you to start with pyrogen.
So when we talk about pyrogen, the name itself tells us, right, that you're talking about a lot of putridness. We're going to be talking about suppuration, etc. And even that is how it's prepared. So I'll first start with, again, the sort of obstetric application where pyrogen is such a good remedy that it can be used to prevent sepsis even post-operatively. So again, pyrogen 1 m 1 dose. See, today's day and age, we are seeing, yes, less of infections because of the standard of, asepsis and the care and, the precautions that one has to take. But earlier, post-op infections were much higher. So in such a case, if somebody is practicing in, a slightly more basic setup, or you are associated with a nursing home, which may not be, a multi-specialty or a tertiary care hospital, you can definitely use pyrogen 1 m as a start dose for preventing sepsis. That's one of its keynote symptoms. Other things, I think you have to really talk about fever when you talk about pyrogen and kind of, differentiate it from other remedies where in the fever state, there's a lot of body ache. So the sore bruised feeling that one typically associates with arnica, lot of pain. And this symptom is actually very helpful in practice because most viral fevers present with a lot of pain. And I'm not just talking about chikungunya, or I'm talking about generally, like today also you see patients complain of fever with no localizing symptom of respiratory or gastric, but they complain of intense back pain or muscle pain. So pains with fever, especially the sore bruised feeling, don't forget the utility of pyrogen. Pains which are usually the pains and the other general symptoms actually get better or the intensity reduces during the heat stage of fever. That's one characteristic of pyrogen. And as Dr. Atul says, yes, there's delirium, there's prostration. But the characteristic of the prostration in pyrogen is that even though there's prostration, there's the element of restlessness. So again, your cross-reference to arsenic comes in. Because arsenic is also restless, but is too weak to kind of, so that's something. And as Dr. Atul said, there's a lot of loquacity and a more heightened or a more excited state in fever. That's something that I've verified, and everybody knows the, sort of keynote symptom here, which is pulse rate that is out of proportion to temperature.
Out of proportion.
That's, and I hope everybody understands clinically what that is because, again, that tells you which type of fevers you use it for, right? Because the normal physiology of the body is tachycardia, 10:1 with every degree rise in fever. But here we see a relative bradycardia in comparison to the temperature. So again, you have to clinically apply that to which fevers present like that, and then you could prescribe it. And I think if I have to, again, differentiate it from other fever remedies, there's a lot of profuse perspiration, which typically everybody knows, right? Everybody at home also knows this, that when you sweat, it means ki bukhar utar gaya. We always say the fever has broken. And it typically is supposed to bring down the temperature. But in pyrogen, and you can open your Boger and check this out, sweating without relief. So you have to, again, open aconite, you have to differentiate, and that will help. Aconite bacteria. So this is about the fever. And before I ask you to take over, I'll just add one symptom of nausea. Better by hot drinks. We don't normally think of pyrogen But with the halitosis, the putridity in the mouth, there is nausea. If it's better by hot drinks, include pyrogen. So I think that's pretty much my sort of clinical information about pyrogen.
Yeah. So, just what you, I'll just, it will be like underlining it's a very important remedy for absolute septic fevers that are covered, that covers where the patients are landing into multi-organ failures, when the patients are landing into kidney failures, there is collapsed lung, when there is increased blood counts, when there is pro-BNP counts are going very high. And when this, what you importantly said in there, you will always say that in previous sessions, we have discussed a lot of remedies like poison, snake poisons, this and that. But what you said here is that perspiration doesn't improve the symptoms. This, if is there in your case, in the cases of septic fever, we should be able to get great success with this remedy. And obviously, when we are dealing such kind of fever where there is hallucinations, where the patients are feeling a lot of change in when there is a lot of delirium, such kind of cases, the remedies might change every 4 hours, every 6 hours, but one of the remedies should always be pulsatilla in a very, very high potency, might be repeated in frequency. So this is very, very important what you highlighted. And obviously, everything you have covered. Just the one thing, that quickly oscillating temperature is one of the very important symptoms. That fever might spike up very high. It might come down very easily, but it keeps spiking. And inertia of bowel like opium. Yes, Ashi, you're right. Yeah. Just one thing, that this what we spoke about is about the active state of fever. Now, this active state of fever, when we are trying to treat, we have spoken about all the conditions where pyrogen would be indicated. There will be a lot of times when patients come that I had a history of fever, which went for this and that and all that things you cover up, and then the patient comes up with saying that now I have skin complaints. Now I have this pustular boils coming up. Now I have this pustular acne coming up. Also, in these cases, I think pyrogen comes out as a very good remedy. You might use it in LM potency or you might use it in 30C potency, but this really gives wonderful results. This I have also confirmed. So I think these are just two phases where one, you can actively use it in high fevers, or when the patient has passed that phase of high fevers and now landed up into this typical pustular acne eruptions, might be in the back, might be on face. So in that case also you can think of using pyrogen.
Pyrogen, super. That's interesting.
Yeah, so that was about pyrogen. Anything else about pyrogen?
I think that's pretty much it. Yeah. The fever is essentially, and like I said, sepsis, and obviously in Gynac we use it for puerperal sepsis, where there's fever postpartum, for various reasons, whether it's originating because of a breast abscess, whether it's originating from a genital infection or, a UTI. So anything that causes fever in the postpartum first 10 days, one of the differential remedies, obviously based on acute totality, is pyrogen, which can be thought of.
Okay. So that was it about today. We'd like to thank you once again for coming. We are so happy that you came, you shared your knowledge, and you gave us such highlighting points. So thank you so much, Dr. Kanika, ma'am.
Thank you. Please call me Kanika. So thanks. I think I should be the one to say thanks to you and to everyone who, like I said before, has taken time out on a Saturday night. It will be so nice to work with people like you all who are so dedicated and committed to learning, and homeopathy has a good future. Let me put it that way. But on a more serious note, thank you so much, Dr. Abhishek. This has really been wonderful, and your initiative is amazing. And to all of you listening in, thank you. If there's something that you need me to, repeat, or if there's something that you'd like to ask in terms of a question, you can always reach out to Dr. Abhishek and he'll let me know.
Yeah. Thank you so much, ma'am. Good night. Bye-bye. Bye-bye,
everybody. Enjoy your Sunday, everybody.
Yeah.
Thank you. Take care, everyone. Bye.
Take care. Bye-bye.